public health authorities and global surveillance networks are tracking a quiet, yet highly lethal biological threat that operates with what experts describe as a silent strike. Hantavirus presents one of the most deceptive clinical profiles in modern virology, initially disguising itself as a standard common cold or seasonal influenza before triggering a rapid, life-threatening progression where a patient's lungs fill with fluid. This condition, known as hantavirus pulmonary syndrome, or HPS, carries a high case fatality rate, often reaching between 30 and 50% depending on the specific viral strain and the speed of medical intervention. Because the early symptoms are entirely nonspecific, patients and healthcare providers frequently misjudge the severity of the infection during its initial days, allowing the pathogen to replicate unchecked until the disease reaches a critical sudden turning point. +1 The geographic footprint of hantavirus is extensive, divided into distinct regional syndromes based on the specific viral strains and their corresponding rodent reservoirs. In the Americas, surveillance efforts focus heavily on strains causing pulmonary illness, a tracking framework established largely after a significant 1993 outbreak in the Four Corners region of the United States. Conversely, hantaviruses found across Europe and Asia primarily manifest as hemorrhagic fever with renal syndrome, or HFRS, which targets the kidneys and circulatory system rather than the respiratory tract. Recent developments have underscored the global nature of this threat, as the World Health Organization and the Centers for Disease Control and Prevention responded to a multi-country cluster of severe acute respiratory illness linked to travel in the Atlantic Ocean. This outbreak, confirmed to be caused by the Andes virus variant, has drawn intense focus from epidemiologists due to its documented ability to spread via limited human-to-human transmission under close and prolonged contact, a characteristic not shared by most other hantaviruses. +4 Understanding the mechanism of transmission is vital for contextualizing why this pathogen remains a persistent public health concern. Hantaviruses are zoonotic, existing naturally within specific wild rodent populations without causing symptomatic disease in the animals themselves. The virus is continuously shed into the environment through rodent urine, feces, and saliva. Human infection rarely occurs from direct bites. Instead, it is driven by the inhalation of aerosolized viral particles. When dried rodent excreta or nesting materials are disturbed during routine cleaning, agricultural activities, or entering long-closed spaces like cabins and sheds, microscopic particles become suspended in the air. Individuals breathing in this contaminated dust unwittingly introduce the virus directly into their respiratory systems. From that moment, an incubation period begins, typically lasting between 1 and 8 weeks, during which the patient remains entirely asymptomatic while the virus establishes itself within the host's vascular endothelial cells. The core operational response to hantavirus relies on an intricate network of public health agencies, reference laboratories, and intensive care units working in tandem to identify and manage infections before they become fatal. When a suspected case presents at a clinic or hospital, medical teams face an immediate diagnostic hurdle. Because the virus initially mimics benign respiratory conditions, definitive identification cannot rest on clinical symptoms alone. Instead, global diagnostic protocols require specific laboratory verification. Laboratories utilize enzyme-linked immunosorbent assay or ELISA testing to detect hantavirus-specific IgM antibodies, which indicate an acute, ongoing infection alongside rising IgG antibody titers. During the earliest acute phase of the illness, when viral RNA is circulating in the patient's bloodstream, molecular methods such as reverse transcription polymerase chain reaction, or RT-PCR, genetic sequencing are deployed to confirm the presence of the pathogen and identify the exact strain. +6 The biohazard risks associated with handling hantavirus specimens dictate stringent logistical and safety measures. Because non-inactivated patient samples pose a severe risk of laboratory-acquired infection through accidental aerosol generation, international guidelines mandate that testing must be conducted under maximum biological containment conditions. Public health agencies require a strict triple packaging system for transporting these specimens both nationally and internationally to prevent leakage or exposure. This meticulous lab protocol ensures safety, but can introduce logistical timelines that contrast with the rapid progression of the disease. While public assumptions might suggest that a rapid test can instantly confirm an infection, Verified medical data shows that early diagnosis within the first 72 hours of symptom onset remains exceptionally difficult. The virus may not yet be present in high enough concentrations in body secretions, often forcing clinicians to perform repeat diagnostic testing 72 hours after the initial presentation to achieve a definitive result. Plus one inside medical facilities, the management of confirmed or suspected hantavirus pulmonary syndrome represents a race against time, as patients can deteriorate from mild illness to respiratory failure within a short window. Data verified by the Centers for Disease Control and Prevention indicates that there is currently no approved antiviral treatment or specific cure for hantavirus infection. Consequently, clinical intervention is entirely supportive and must begin immediately in an intensive care environment, even before laboratory confirmation is finalized. Hospital management focuses heavily on maintaining oxygenation and protecting cardiovascular stability. This involves the continuous monitoring of cardiac function, the highly precise administration of intravenous fluids to avoid exacerbating pulmonary edema, and the provision of supplemental oxygen. In severe cases, rapid intubation and mechanical ventilation or extracorporeal membrane oxygenation are required to keep the patient alive while the body fights off the acute phase of the infection. Epidemiological data compiled by the Pan American Health Organization shows that while total case numbers remain relatively low globally compared to other respiratory viruses, the consistently high lethality rate keeps hantavirus at the top of priority surveillance lists for regional health ministries. Mitigating the risk of hantavirus requires robust public health surveillance, combined with precise, accessible guidance on prevention for individuals living or working in endemic areas. Because there is no vaccine available to provide immunity, the primary line of defense is vector control and the minimization of human-rodent contact. Public health agencies advise the public to focus on rodent exclusion by sealing holes and cracks in homes, barns, and outbuildings that could allow mice or rats inside. Maintaining clean environments, storing food in rodent-proof containers, and utilizing traps are standard recommendations to reduce infestations around residential structures. However, the most critical guidance involves the proper remediation of existing rodent habitats. Standard cleaning practices, such as sweeping or vacuuming dry droppings, are actively discouraged because they disturb the waste and create the exact viral aerosols responsible for transmission. Instead, official guidelines dictate soaking the affected area thoroughly with a disinfectant or a diluted bleach solution for several minutes to inactivate the virus before wiping it up with paper towels while wearing protective gloves and masks. Plus 3 on. A broader scale, public health surveillance systems serve as the early warning apparatus for detecting shifts in hantavirus activity. In many countries, hantavirus infections are designated as nationally notifiable conditions, legally requiring hospitals, clinicians, and diagnostic laboratories to report verified cases immediately to local and central health departments. This data collection allows epidemiologists to monitor geographic trends, identify emerging clusters, and deploy targeted risk communication to affected communities. Despite these comprehensive frameworks, significant limits to scientific knowledge remain. Predicting exactly when and where a hantavirus surge will occur is complex, as rodent population dynamics are heavily influenced by fluctuating environmental and ecological factors, such as seasonal rainfall patterns, food availability, and winter temperatures that alter survival rates. Furthermore, while the general mechanics of rodent-to-human transmission are well documented, the precise biological variables governing person-to-person transmission in specific strains like the Andes virus remain under continuous study, constrained by the rare and sporadic nature of these outbreaks. Plus one, as global health organizations continue to refine diagnostic tools and improve clinical response strategies, public awareness remains the most effective tool to counter this pathogen's silent progression. Recognizing that early symptoms can masquerade as a common cold and understanding the environments where exposure occurs allows for faster medical-seeking behavior, which remains the single greatest factor in surviving an infection. By maintaining strict environmental hygiene and adhering to established safety protocols during cleanup operations, the risks associated with this severe disease can be significantly managed. For ongoing updates on global public health developments and deep dives into epidemiological reporting, consider subscribing to this channel to stay informed on vital medical and science news. When a patient presenting with advanced respiratory distress or severe flu-like symptoms enters a medical facility, the diagnostic process for hantavirus requires immediate acceleration through specialized laboratory channels. Because early clinical signs are virtually indistinguishable from routine seasonal viruses, definitive confirmation relies entirely on objective laboratory testing rather than symptomatic observation. Public health agencies utilize a multi-tiered testing protocol to confirm suspected cases. The primary screening mechanism involves serological testing, specifically an enzyme-linked immunosorbent assay known as an ELISA test. This method looks for hantavirus-specific immunoglobulin M, or IgM, antibodies in the patient's blood, which signify an active, acute infection. Simultaneously, reference laboratories test for immunoglobulin G, or IgG, antibodies to map the immune response. In the earliest hours of the illness, before an antibody response is fully mounted, molecular diagnostics become essential. Technicians employ reverse transcription polymerase chain reaction, or RT-PCR, testing to detect viral ribonucleic acid or RNA in blood or tissue samples. This molecular approach confirms the presence of the pathogen and allows scientists to sequence the viral genome. Identifying the specific strain, the physical handling and processing of suspected hantavirus specimens introduce rigorous biosafety protocols that heavily impact laboratory logistics. Because hantaviruses are highly infectious via compressed aerosols, non-inactivated patient samples represent a severe biohazard to personnel. Consequently, international guidelines dictate that any manipulation of live virus or viable clinical specimens must occur within high containment facilities, typically designated as Biosafety Level 3 laboratories. These facilities operate under negative air pressure and utilize high-efficiency particulate air filtration systems to ensure no viral particles escape. For rural or community hospitals lacking these specialized units, samples must be securely packaged using a certified triple packaging system designed to withstand structural impacts during transit to national reference laboratories. This transport process requires meticulous documentation and chain of custody tracking. While these safety measures protect staff, they create a logistical timeline where definitive confirmation can take 24 to 72 hours, forcing clinicians to make critical, real-time treatment decisions based on clinical suspicion rather than waiting for a finalized report. Inside the intensive care unit, medical teams face an exceptionally narrow window to stabilize patients as the disease transitions from a mild prodrome to a critical respiratory crisis. Verified data establishes that there is no specific antiviral cure or targeted therapeutic intervention currently approved for hantavirus pulmonary syndrome. Hospital management is entirely supportive, focusing on maintaining physiological stability, while the patient's immune system clears the pathogen. The hallmark of the severe phase is non-cardiogenic pulmonary edema, where the virus causes blood vessels in the lungs to become highly permeable, allowing fluid to rapidly flood the alveolar spaces. Managing this fluid shift presents a severe clinical challenge. Clinicians must maintain a delicate hemodynamic balance. Administering excessive intravenous fluids to combat low blood pressure can accelerate the flooding of the lungs, while underfluid resuscitation can lead to systemic shock. To counter oxygen deprivation, treatment scales from supplemental oxygen masks to invasive mechanical ventilation. In the most severe cases, advanced medical centers deploy extracorporeal membrane oxygenation, or ECMO, which temporarily takes over the work of the heart and lungs, pumping blood outside the body to remove carbon dioxide and infuse oxygen, giving the respiratory system a vital window to recover. Preventing hantavirus infection relies on rigorous vector management and environmental hygiene to disrupt the interface between human spaces and rodent reservoirs. Because vaccines are currently unavailable, public health guidance focuses on practical measures to mitigate risk in endemic regions. The primary strategy involves structural exclusion, sealing entry points in homes, barns, and cabins larger than 1/4 of an inch, using durable materials like steel wool or hardware cloth. Property owners must eliminate nesting sites by clearing brush piles from foundations and storing food in airtight containers. When entering enclosed spaces sealed for extended periods, such as cabins or storage sheds, immediate entry is discouraged. Doors and windows should be open for 30 minutes to allow passive ventilation. The cleaning process itself requires strict safety protocols to prevent aerosolizing dried viral particles. Sweeping or vacuuming dry rodent droppings or nesting material is strictly contraindicated, as these actions launch viral particles into the breathing zone. Instead, the correct procedure mandates saturating affected areas with a disinfectant or a mixture of 1 part bleach to 9 parts water. The solution must sit for 5 minutes to inactivate the virus. Only after complete soaking should the waste be wiped up using disposable cloths, which must be double bagged and discarded. Throughout this process, individuals should wear rubber gloves, and in highly contaminated settings, high-efficiency particulate air masks are recommended. On a systemic level, public health frameworks rely on epidemiological surveillance to detect patterns of infection and prevent outbreaks. In many jurisdictions, hantavirus is a legally reportable condition, requiring clinical laboratories and physicians to log verified cases with local health authorities immediately. This data allows researchers to track regional case numbers, monitor shifting geographic boundaries of viral strains, and deploy targeted warnings to communities experiencing localized spikes. Alongside human tracking, ecological surveillance teams monitor wild rodent populations, collecting samples to assess viral prevalence within specific species. Despite these efforts, significant limits to scientific knowledge persist, highlighting the challenges of predicting exactly when and where an outbreak will occur. Rodent population dynamics are governed by complex ecological systems that are difficult to model with complete accuracy. Factors such as unexpected seasonal rainfall, mild winter temperatures boosting rodent survival, and mast years where forests produce a surplus of seeds can trigger rapid population explosions of reservoir hosts, leading to a delayed increase in human exposure risk. Furthermore, while rodent-to-human transmission is well understood, the precise genetic factors allowing rare variants, like the Andes virus, to transmit from person to person remain under continuous study. Ethical public health reporting demands a balanced approach that contextualizes the severe nature of hantavirus without generating unwarranted panic or stigma against rural populations. While the high case fatality rate demands rigorous clinical respect and immediate medical attention upon the presentation of severe respiratory symptoms following potential exposure, the absolute number of cases recorded globally remains low compared to pervasive respiratory pathogens like influenza. Providing detailed public guidance empowers individuals with the practical knowledge necessary to protect themselves during routine tasks, transforming an invisible environmental hazard into a manageable risk. Public health communication emphasizes that awareness, rather than anxiety, is the key to reducing mortality. Recognizing a history of rodent exposure and conveying that information to emergency physicians can dramatically accelerate the diagnostic timeline and lead to earlier supportive care. Ethically, the medical community emphasizes that disease management must be paired with continued research to develop targeted therapeutics, ensuring that populations exposed to zoonotic vectors are not left without definitive medical solutions. By understanding transmission pathways and respecting ecological realities, society can maintain an effective defense against this public health threat. For continued comprehensive, fact-based reporting on global public health developments and critical medical breakthroughs, consider subscribing to this channel to stay informed.